Hi everyone, it's Dr. Jhawar with Revive MD Direct Primary Care. It's time for some more frequently asked questions about DPC. If you haven't had a chance to see my previous videos, you can find them on my website, which is revivedpc.com. They're also on my YouTube channel, which is Revive DPC, and you can also find them on my social media pages. Many patients of mine who are just about to go on to Medicare and several other patients who have family members on Medicare oftentimes will ask me, how does direct primary care work once you're on Medicare? So the simple answer is that Medicare, just like other insurance plans, can work well with direct primary care. And I can explain how it can work. So Medicare insurance oftentimes will provide good coverage for blood work, maybe some good coverage for imaging tests and screening tests for sure. Medicare can provide coverage for referrals to specialists. And depending on the type of Medicare plan that you have, you may or may not get some adequate coverage for medications. However, joining a direct primary care practice and paying that monthly membership provides a lot of advantages and things that Medicare doesn't cover. So for that monthly fee that Medicare patients would pay as part of my practice, they're getting a lot in return. Medicare cannot guarantee that you could call up a primary care doctor's office and be seen within a week as a new patient. Medicare cannot guarantee that you could pick up the phone or email your doctor directly or text your doctor about some health concerns. Medicare does not guarantee that you would have every visit with your primary care doctor and not a PA or a nurse practitioner. Medicare does not guarantee that once you have those visits with your doctor, that they'll be lengthy, unrushed visits where you can get all of your questions and concerns addressed. Medicare does not guarantee that you would have ease of access, prompt responses when you actually need to see somebody, and convenient type of options with in-person visits, virtual visits, phone visits, and texting correspondence with your doctor. So these are all things that direct primary care does guarantee and does provide. But this is just like other insurance plans. Medicare can't guarantee those things. And so I think that direct primary care is very unique in that way, but it can also pair very well even if you're on Medicare. So for those my patients who are on Medicare, they really like the benefits that direct primary care provides because, let's face it, as our population gets older, more and more people are trying to take care of their health. They're trying to be proactive. They want to see a doctor who they're comfortable with, who actually knows their medical history, and not to be seeing a different provider every time they go to the doctor's office. I also think that, my Medicare patients, they find it so useful to have these more personalized, longer visits with me where I can spend time on, focusing on reducing their medications or figuring out how to prevent future and further illnesses or chronic diseases. So I think that for Medicare patients, direct primary care can be really, really advantageous and can be so beneficial as we're getting older too. So if you know anybody who's going to be going on to Medicare or someone who's already on Medicare but is looking for a different kind of practice where they get more attention, more personalized, detailed, quality primary care without having the long wait times, have them check out direct primary care. You'd be surprised there are lots of patients already taking advantage of direct primary care locally in our area. So I will be back again with more frequently asked questions about DPC. Stay tuned for more.